Patient X is a 55-year-old man, Filipino citizen, with a chief complaint of cough, exertional dyspnea, and fatigue. And he was diagnosed with acute heart failure. Patient X has a history of coronary artery disease, chronic systolic heart failure, and chronic obstructive pulmonary disease. Presented to the hospital with 5 days of cough, exertional dyspnea, and fatigue. Upon arrival at the emergency department on September 1, 2021, at 8:30 a.m., the patient was found to have a white blood cell count of 15,000, serum sodium of 123 milliequivalents per liter, creatinine of 1.6 mg per deciliter, and NT-proB type natriuretic peptide level of 4,800 nanograms per milliliter. An ECG showed sinus tachycardia with a chronic left bundle branch block. Initial cardiac-specific troponin was mildly elevated. He was short of breath and mildly hypoxic, with a room air oxygen saturation of 90%. A chest X-ray showed a right-sided pleural effusion and some subtle interstitial infiltrates bilaterally. Patient X's past medical history was notable for a remote history of emergent percutaneous coronary intervention for an acute anterior myocardial infarction complicated by systolic heart failure. His left ventricular ejection fraction was most recently noted to be 25%. He received an implantable cardioverter defibrillator for primary prevention. It is a small electronic device connected to the heart. It is used to continuously monitor and help regulate potentially fast and life-threatening electrical problems with the heart. This is the legend. X for deceased, red heart for the history of acute heart failure, yellow thunder for the history of hypertension, and green sun for the history of diabetes. As you can see on the paternal side, they have a history of hypertension and diabetes. On the maternal side, her mother-in-law has a history of hypertension. And then the patient was diagnosed with acute heart failure. There is a chance that the patient may acquire cardiovascular diseases because it present in their family. Patient X enjoys watching television. He sat in front of the television all of the time and only went out to interact with his neighbors sometimes. His family almost always cooks high-fat, high-sugar foods like fatty pieces of meat and fried chicken, and processed foods. He naps in the afternoon as well, making it difficult for him to sleep in the evening and causing him to wake up early in the morning. He sleeps for 5 to 6 hours each day. He takes a bath 3 times a week. He started smoking at the age of 21 and stopped at the age of 47 when he was diagnosed with COPD. He has a 26-pack-year history of smoking. Modifiable risk factors: lack of physical activity, unhealthy diet, high blood pressure and smoking. For non-modifiable risk factors, we have the age, which is 55 years old, gender, which is male, and family history of hypertension. The significant myocardial dysfunction usually occurs before the patient experiences signs and symptoms of HF such as shortness of breath, edema, or fatigue. And then there will activation of baroreceptors. The decreased blood flow is sensed by baroreceptors in the aortic and carotid bodies. The sympathetic nervous system is then stimulated to release epinephrine and norepinephrine. The purpose of this initial response is to increase heart rate and contractility and support the failing myocardium. Sympathetic stimulation causes vasoconstriction in the skin, gastrointestinal tract, and kidneys. A decrease in renal perfusion due to low carbon dioxide and vasoconstriction then causes the release of renin by the kidneys. Angiotensin-converting enzyme in the lumen of pulmonary blood vessels converts angiotensin I to angiotensin II, a potent vasoconstrictor, which then increases the blood pressure and afterload. Angiotensin II also stimulates the release of aldosterone from the adrenal cortex, resulting in sodium and fluid retention by the renal tubules and an increase in blood volume. These mechanisms lead to the fluid volume overload commonly seen in heart failure. Angiotensin, aldosterone, and other neurohormones lead to an increase in preload and afterload, which increases stress on the ventricular wall, causing an increase in cardiac workload. As the heart's workload increases, contractility of the myocardial muscle fibers decreases. Decreased contractility results in an increase in end diastolic blood volume in the ventricle, stretching the myocardial muscle fibers and increasing the size of the ventricle or the ventricular dilation. As cardiac cells die and the heart muscle becomes fibrotic, diastolic heart failure can develop, leading to further dysfunction.
Laboratory and diagnostic procedure. Complete blood count. Date. Indication, purpose, it evaluate the cells that circulate in blood, including red blood cells, RBCs, white blood cells, WBCs, and platelets, PLTs. The CBC can evaluate your overall health and detect a variety of diseases and conditions. Nursing responsibility. 1. Before the procedure. Explain test procedure. Explain that slight discomfort may be felt when the skin is punctured. 2. Encourage to avoid stress if possible because altered physiologic status influences and changes normal hematologic values. 3. Explain that fasting is not necessary. However, fatty meals may alter some test results as a result of lipidemia. 4. Apply manual pressure and dressings over puncture site on removal of syringe. 5. Monitor the puncture site for oozing or hematoma. 6. Instruct to resume normal activities and diet. 7. The test itself does not cause dizziness, but it will be able to detect factors that causes dizziness. Results: 15,000. Reference: 4,500 11,000 per cubic millimeters. Remarks: elevated. Analysis, interpretation. White blood cell, WBC, count increases during infections and inflammatory illnesses and has been shown to predict coronary heart disease, CHD, independent of traditional cardiovascular risk factors. Complete metabolic panel. Indication, purpose. A comprehensive metabolic panel, CMP, is a test that measures 14 different substances in your blood. It provides important information about your body's chemical balance and metabolism. It measures the amounts of certain substances like electrolytes, fats, proteins, glucose and enzymes in the body. It gives important information about how well a person's kidneys, liver, and other organs are working. Procedure. A healthcare professional will take a blood sample from a vein in your arm, using a small needle. After the needle is inserted, a small amount of blood will be collected into a test tube or vial. You may feel a little sting when the needle goes in or out. This usually takes less than 5 minutes. Nursing responsibility. 1. Before the procedure. Explain test procedure. Explain that slight discomfort may be felt when the skin is punctured or bruising at the spot where the needle was put in, but most symptoms go away quickly. 2. Instruct the patient to stop eating and drinking for 10 to 12 hours before the blood test. 3. Apply pressure to the site where the needle entered the skin. A bandage will be applied and will need to remain in place for 10 to 20 minutes to stop any bleeding. 4. Inform the client to avoid using that arm for heavy lifting for the rest of the day. The result of serum sodium is 123 milliequivalent per liter, which is decreased. The result of creatinine is 1.6 mg per deciliter, which is elevated. Analysis, interpretation. The sodium level is decreased, which indicated that the patient is hyponatremia, which causes the patient to progressively less responsive and more lethargic. The creatinine is elevated. The patient is anuric, which means the kidney doesn't produce urine. Natriuretic peptide test. Indication, purpose, measure the levels of brain natriuretic peptide or N-terminal pro-B-type natriuretic peptide in your blood. A BNP test or an NT-proBNP test is most often used to diagnose or rule out heart failure. If you've already been diagnosed with heart failure, the test may be used to find out the severity of the condition. Plan treatment and find out if treatment is working. Procedure. It is done by drawing blood from a vein in your arm using a hypodermic needle. This process is known as venipuncture. A machine then measures levels of BNP or another heart hormone, called N-terminal proBNP, NT-proBNP, in the blood sample. The results from the test are usually ready in 15 to 20 minutes. Nursing responsibility. 1. Before the procedure. Explain test procedure. Explain that slight discomfort may be felt when the skin is puncture or bruising at the spot where the needle was put in, but most symptoms go away quickly. 2. Apply pressure to the site where the needle entered the skin. A bandage will be applied and will need to remain in place for 10 to 20 minutes to stop any bleeding. 4. Inform the client to avoid using that arm for heavy lifting for the rest of the day. Results: 4,800 nanograms per deciliter. Analysis, interpretation. The patient NT-proBNP result is elevated, which means the heart isn't pumping enough blood to supply the body needs, which causes heart failure. Arterial blood gas. Indication, purpose. Measures the acidity, pH, and the levels of oxygen and carbon dioxide in the blood from an artery. This test is used to find out how well your lungs are able to move oxygen into the blood and remove carbon dioxide from the blood. Procedure. Arterial blood can be obtained from an artery in the wrist, arm, or groin, or pre-existing arterial line if currently hospitalized. A healthcare provider will first sterilize the injection site with an antiseptic. Once they find an artery, they'll insert a needle into the artery and draw blood. It might feel a slight prick when the needle goes in. Arteries have more smooth muscle layers than veins. Nursing responsibility. 1. Explain test procedure. Explain that slight discomfort may be felt when the skin is puncture or bruising at the spot where the needle was put in. 2. Clean the injection site with an antiseptic solution. 3. Instruct the patient to breathe normally during the test, and warn him that he may experience a brief cramping or throbbing pain at the puncture site. 4. After the needle is removed, press and provide pressure to the injection site for a few minutes before putting a bandage over the puncture wound. 5. Monitor vital signs and observe for signs of circulatory impairment. Results: pH of 7.2. Reference: 7.35 7.45. Remarks: decreased. Analysis, interpretation. The patient metabolic acidosis is worsened because of too much acid is produced in the body and the kidney cannot remove enough acid from the body. Electrocardiogram, ECG. Indication, purpose. It is a test that can be used to check heart's rhythm and electrical activity. Sensors attached to the skin are used to detect the electrical signals produced by the heart each time it beats. Procedure. During an ECG, up to 12 sensors, electrodes will be attached to your chest and limbs. The electrodes are sticky patches with wires that connect to a monitor. They record the electrical signals that make your heart beat. A computer records the information and displays it as waves on a monitor or on paper. Nursing responsibility. 1. Obtain consent form. 2. Explain the procedure to the patient. 3. Ensure to empty the bladder. Instruct patient to void prior and to change into a gown. 4. Encourage the patient to cooperate. Advise the patient to remain still during the test because movement may distort results. 5. Inform that a conductive gel is applied to the chest area. 6. When the procedure is completed, remove the gel from the patient's chest wall. 7. Inform the patient that the study will be interpreted by the physician. Results: sinus tachycardia with chronic left bundle block. Analysis, interpretation. The patient left bundle branch is blocked, which caused problem in the left branch of the electrical conduction system. The signal in the left ventricle slows down because the electrical signal can't travel down this path the way it normally would. This can cause an uncoordinated contraction of the heart. As a result, the heart may eject blood less efficiently. Chest X-ray. Indication, purpose. An imaging test that uses small amounts of radiation to produce pictures of the organs, tissues, and bones of the body. Procedure. Inform the client this procedure can assist in assessing the heart and lungs for disease. Ensure that the client has removed all external metallic objects from the area to be examined. Instruct the client to cooperate fully and to follow directions. Instruct the client to remain still throughout the procedure because movement produces unreliable results. Place the client in the standing position facing the cassette or image detector, with hands on hips, neck extended, and shoulders rolled forward. Position the chest with the left side against the image holder for a lateral view. Ask the client to inhale deeply and hold his or her breath while the X-ray images are taken, and then to exhale after the images are taken. Nursing responsibility. 1. Inform the client this procedure can assist in assessing the heart and lungs for disease. 2. Review the procedure with the client. Address concerns about pain and explain that no pain should be experienced during the test. 3. Inform the client that the procedure is performed in the radiology department or at the bedside by a registered radiological technologist, and takes approximately 5 to 15 minutes. 4. Instruct the client to remove all metallic objects from the area to be examined. Results: a right-sided pleural effusion and some subtle interstitial infiltrates bilaterally. Analysis, interpretation. The patient has an excessive buildup of water in his right-sided lung which cause shortness of breath to the patient and become hypoxic. The patient has community-acquired pneumonia. Intra-aortic balloon pump, IABP. Indication, purpose. An intra-aortic balloon pump, IABP, is a type of therapeutic device. It helps the heart to pump more blood. It may need it if the heart is unable to pump enough blood in the body. Procedure. This procedure is done through a small cut on the inside of the upper leg. The healthcare provider will insert the balloon pump catheter into an artery in the leg. He or she will then guide it to your aorta. From there, the IABP can start to do its work. The balloon is set to inflate when the heart relaxes. It pushes blood flow back toward the coronary arteries. They may not have been receiving enough blood without the pump. When the heart contracts, the balloon deflates. That allows the heart to pump more blood out to the body while using less energy. The device continues to inflate and deflate until it is removed. Nursing responsibility. 1. Obtain consent form. 2. Gather all the equipments needed. 3. Prior performing the procedure, a baseline assessment is performed incorporating lower and upper limb perfusion. 4. Assess level of consciousness, lock, heart rate and rhythm, color, temperature, capillary refill, sensation and movement of both lower extremities. 5. Assess the patient tolerance of lying flat. 6. Assess insertion site each shift for redness, ooze, signs of bleeding, infection, hematoma, pain, or compartment syndrome of the affected limb and skin integrity. Results: immediate improvement in the patient's mean arterial blood pressure. Analysis, interpretation. With the use of intra-aortic balloon pump, the patient arterial blood pressure improved immediately because the heart pumps more blood and it can now flow out to the rest of the body. Swan-Ganz catheterization. Indication, purpose, is the passing of a thin tube into the right side of the heart and the arteries leading to the lungs. It is done to monitor the heart's function and blood flow and pressures in and around the heart. Procedure. The patient will lie on a padded table. The doctor will make a puncture into a vein near the groin or in your arm or neck. A flexible tube, catheter or sheath, is placed through the puncture. Sometimes, it will be placed in your leg or your arm. The patient will be awake during the procedure. A longer catheter is inserted. It is then carefully moved into the upper chamber of the right side of the heart. X-ray images may be used to help the healthcare provider see where the catheter should be placed. Blood may be removed from the catheter. This blood is tested to measure the amount of oxygen in the blood. During the procedure, the heart's rhythm will be constantly watched using an electrocardiogram. Nursing responsibility. 1. Obtain consent form. 2. Have the blood pressure and pulse checked. Ask the client to empty bladder before the procedure. 3. Remove any jewelry in the patient's body. 4. Clean and shave the area where the catheter will be inserted. 5. Assess insertion site each shift for redness, ooze, signs of bleeding, infection, hematoma, and pain. 6. Monitor the patient after the procedure. Results. A Swan-Ganz catheter was placed in order to assess the patient's invasive hemodynamics on his present level of circulatory support, and revealed a result. Pulmonary artery, PA pressure, 50/30ths. Mean PA pressure 37 mm of mercury. Central venous pressure 13 mm of mercury 2 to 5 mmHg. Peak cardiac output 6.2 L per minute 4 to 8 L per meter. Peak cardiac index 2.8 L per minute per square meter 2.54 L per meter. Mixed venous oxygen saturation 68%. Analysis, interpretation. The patient pulmonary artery pressure is elevated, which the capillary hydrostatic pressure exceeds capillary osmotic pressure and fluid is forced out of the vessels. PA pressure greater than 35/20ths of a millimeter of mercury is considered pulmonary hypertension. The central venous pressure is elevated, which indicates right atrial dysfunction. The patient cardiac output and index is within the normal limits.
For the nursing care plan. For the assessment. Subjective. The patient verbalizes fatigue. For the objective. Shortness of breath. Fatigue. Cool extremities. Weakness. Mildly hypoxic. Decreased urine output. ECG conduction abnormality. Cough. For the nursing diagnosis. Decreased cardiac output related to altered myocardial contractility as evidenced by changes in blood pressure, cool extremities, weakness, and decreased urine output. For the planning. Within 8 hours of nursing intervention, the patient will be able to demonstrate hemodynamic stability as evidenced by having blood pressure, cardiac output, and urinary output within normal limits. For the intervention. Establish rapport. Monitor cardiac rhythm continuously. Monitor vital signs frequently. Monitor intake and output. Monitor patient reports of chest pain. Note location, intensity, characteristics and radiation of pain. Ensure patients remain on bed rest or maintain activity level that does not compromise cardiac output. Provide calm, restful surroundings, minimize environmental activity or noise. Reposition the patient every 2 hours. Dependent nursing intervention. Administer oxygen as indicated. Administer diuretics, inotropic drugs, vasopressors or dilator. For the evaluation. After 8 hours of nursing intervention, the patient was able to demonstrate hemodynamic stability as evidenced by having the vital signs, cardiac output and urinary output within normal limits. For the drug study. For the drug name. Brand name. Rocephin. Generic name. Ceftriaxone. Classification. Cephalosporin, 3rd generation. The mechanism of action. Works by inhibiting the mucopeptide synthesis in the bacterial cell wall. For indication. It lowers respiratory infections caused by Streptococcus pneumoniae and Staphylococcus aureus. For contraindication. Hypersensitive to cephalosporins, penicillins and related antibiotics. For side effect, there is headache, dizziness, lethargy, nausea, vomiting, diarrhea, anorexia, pain, inflammation site in the fourth site. For its nursing responsibility, we need to observe 10 rights in giving medication. Do skin testing into the intradermal area. Educate the patient about the purpose and importance of the drug. During. Use a separate syringe when giving this drug. Have vitamin K available in case of hypoprothrombinemia occurs. After. Discontinue if hypersensitivity occurs. Monitor blood levels in patients taking this drug. For the next drug study. Brand name. Lasix. Generic name. Furosemide. Classification. Diuretic. For its mechanism of action. It inhibit reabsorption of sodium and water in the ascending limb of the loop of Henle. This result in the excretion of sodium, chloride and to lesser degree, potassium and bicarbonate ions. For its indication. Edema due to cardiac, hepatic and renal disease. Contraindication. Contraindicated with allergy and furosemide, allergy to tartrazine, those with anuria, severe renal disease. Adverse effect. Vertigo. Dizziness. Paresthesia. Weakness. Thrombophlebitis. Nausea. Anorexia. Vomiting. Photosensitivity. Pruritus. Urticaria. Nocturia. Urinary bladder spasm. Anemia. For the nursing responsibility. Observe 10 rights in giving medication. Assess allergy for furosemide, sulfonamides and tartrazine. Educate the patient about the purpose and importance of the drug. Check the patency of the fourth site and 4-line. Give early in the day so that increased urination will not disturb sleep. Measure and monitor weight to monitor fluid changes. Monitor blood glucose level. Document and record. Brand name. Prednisone Intensol. Generic name. Prednisone. Classification. Glucocorticoid. Mechanism of action. The anti-inflammatory effect is due to inhibition of prostaglandin synthesis. The drug also inhibits accumulation of macrophages and leukocytes at sites of inflammation and inhibits phagocytosis and lysosomal enzyme release. Indication. Replacement therapy in adrenal cortical insufficiency. Contraindication. Hypersensitivity to drug. Patients with systemic fungal infections. Patient receiving immunosuppressive doses together with live virus vaccines. Adverse effect. Insomnia. Nausea and vomiting. GI upset. Fatigue. Dizziness. Muscle weakness. Increased hunger/thirst. Joint pain. For nursing responsibility. Observe 10 rights in giving medication. Administer drug before 9 a.m. to mimic normal peak corticosteroid blood levels. Increase dosage when patient subjected to stress. Taper doses when discontinuing high-dose or long-term therapy. Document and record. Drug name. Brand name. Intropin. Generic name. Dopamine. Classification. Sympathomimetic. Mechanism of action. It acts on alpha-AMP, beta-adrenergic receptors. It additionally acts on dopaminergic, D2, receptors in renal and mesenteric blood vessels, dilates them. Indication. Dopamine HCl is indicated for the correction of hemodynamic imbalances present in the shock syndrome due to myocardial infarction, trauma, open heart surgery, renal failure and chronic cardiac decompensation as in congestive failure. Contraindication. Pheochromocytoma. Tachyarrhythmias or ventricular fibrillation. Adverse effect. Headache. Dyspnea. Arrhythmia. Hypotension. Angina. Palpitations. Nausea. Vomiting. Irritation at foresight. For nursing responsibility. Monitor blood pressure, pulse and urinary output at intervals prescribed by the physician. Palpate peripheral pulses and assess appearance of extremities routinely during dopamine administration. Notify physician if quality of pulse deteriorates or if extremities become cold. Advise the patient to inform nurse immediately if chest pain, dyspnea, numbness, tingling or burning of extremities occurs and pain or discomfort at the site of administration.